The PBS NewsHour Democratic debate in partnership with Facebook continues. Live from the University of Wisconsin in Milwaukee, once again, Gwen Ifill and Judy Woodruff.
And welcome back to this PBS NewsHour debate, Democratic debate here in Milwaukee. And let's get right to the questions. Senator Sanders, to you first. Coming off the results in Iowa and New Hampshire, there are many voters who are taking a closer look at you and your ideas. And they're asking, how big a role do you foresee for the federal government? It's already spending 21% of the entire U.S. economy. How much larger would government be in the lives of Americans under a Sanders presidency?
Well, to put that into context, Judy, I think we have to understand that in the last 30 years in this country, there has been a massive transfer of wealth going from the hands of working families into the top 0.1%, whose percentage of wealth has doubled. In other words, very rich are getting richer. Almost everybody else is getting poorer. What I believe is the United States, in fact, should join the rest of the industrialized world and guarantee health care to all people. Our Medicare for All single-payer proposal will save the average middle-class family $5,000 a year. I do believe that in the year 2016, we have to look in terms of public education as colleges, as part of public education, making public colleges and universities tuition-free. I believe that when real unemployment is close to 10%, and when our infrastructure, our roads, our bridges, our water systems, Flint, Michigan comes to mind, our wastewater plants, our rail, our airports, in many places are disintegrating, we can create 13 million jobs by rebuilding our infrastructure at a cost of $1 trillion.
But my question is, how big would government be? Would there be any limit on the size and role of government?
Of course there will be a limit. But when today you have massive levels of income and wealth inequality, when the middle class is disappearing, you have the highest rate of childhood poverty of almost any major country on earth. Yes, in my view, the government of a democratic society has a moral responsibility to play a vital role in making sure that all of our people have a decent standard of living.
Judy, I think that the best analysis that I've seen based on Senator Sanders' plans is that it would probably increase the size of the federal government by about 40%. But what is most concerning to me is that in looking at the plans, let's take health care, for example. Last week in a CNN town hall, the senator told a questioner that the questioner would spend about $500 in taxes to get about $5,000 in health care. Every progressive economist who has analyzed that says that the numbers don't add up. And that's a promise that cannot be kept. And it's really important now that we are getting into the rest of the country that both of us are held to account for explaining what we are proposing, because especially with health care, this is not about math. This is about people's lives, and we should level with the American people about what we can do to make sure they get quality, affordable health care.
Well, let us level with the American people. Secretary Clinton has been going around the country saying Bernie Sanders wants to dismantle the Affordable Care Act. People are going to lose their Medicaid. They're going to lose their CHIP program. I have fought my entire life to make sure that health care is a right for all people. We're not going to dismantle anything. But here is the truth. 29 million people have no health insurance today in America. We pay by far the highest prices in the world for prescription drugs. 1 out of 5 Americans can't even afford the prescriptions their doctors are writing. Millions of people have high deductibles and copayments. What I said, and let me repeat it. I don't know what economist Secretary Clinton is talking to. But what I have said, and let me repeat it, that yes, the family right in the middle of the economy would pay $500 more in taxes and get a reduction in their health care costs of $5,000. In my view, health care is a right of all people, not a privilege, and I will fight for that.
Well, I can only say that we both share the goal of universal health care coverage. You know, before it was called Obamacare, it was called Hillary Care. And I took on the drug companies and I took on the insurance companies to try to get us universal health care coverage. And why I am a staunch supporter of President Obama's principle accomplishment, namely the Affordable Care Act, is because I know how hard it was to get that done. We are at 90% coverage. We have to get the remaining 10. I've set forth very specific plans about how to get costs down, especially prescription drug costs. And it is difficult to in any way argue with the goal that we both share, but I think the American people deserve to know specifically how this would work. If it's Medicare for all, then you no longer have the Affordable Care Act, because the Affordable Care Act, as you know very well, is based on the insurance system, based on exchanges, based on a subsidy system. The Children's Health Insurance Program, which I helped to create, which covers 8 million kids, is also a different kind of program. So if you're having Medicare for all, single payer, you need to level with people about what they will have at the end of the process you are proposing. And based on every analysis that I can find by people who are sympathetic to the goal, the numbers don't add up, and many people will actually be worse off than they are right now.
Final thoughts, Senator.
That is absolutely inaccurate. Look, here is the reality, folks. There is one major country on earth that does not guarantee health care to all people. There is one major country, the United States, which ends up spending almost 3 times per capita what they do in the UK, guaranteeing health care to all people. 50% more than they do in France, guaranteeing health care to all people, far more than our Canadian neighbors who guarantee health care to all people. Please do not tell me that in this country, if, and here's the if, we have the courage to take on the drug companies and have the courage to take on the insurance companies and the medical equipment suppliers. If we do that, yes, we can guarantee health care to all people in a much more cost-effective way.
Well, let me just say once again that having been in the trenches fighting for this, I believe strongly we have to guarantee health care. I believe we are on the path to doing that. The last thing we need is to throw our country into a contentious debate about health care again. And we are not England. We are not France. We inherited a system that was set up during World War II. 170 million Americans get health insurance right now through their employers. So what we have tried to do, and what President Obama succeeded in doing, was to build on the health care system we have, get us to 90% coverage. We have to get the other 10% of the way to 100. I far prefer that and the chances we have to be successful there than trying to start all over again, gridlocking our system and trying to get from 0 to 100%.
I'd like to move along. Secretary Clinton. You also have proposed fairly expansive ideas about government. You may remember this pledge from a State of the Union address at which I believe you were present, in which these words were said: the era of big government is over. You may remember that. When asked their feelings about the federal government this week, 61% of New Hampshire Democrats told exit pollsters that they are angry or at least dissatisfied. Given what you and Senator Sanders are proposing, an expanding government in almost every area of our lives, is it fair for Americans who fear government to fear you?
No, but it is absolutely fair and necessary for Americans to vet both of our proposals, to ask the really hard questions about what is it we think we can accomplish, why do we believe that, and what would be the results for the average American family. In my case, whether it's health care or getting us to debt-free tuition or moving us toward paid family leave, I have been very specific about where I would raise the money, how much it would cost, and how I would move this agenda forward. I've tried to be as specific to answer questions so that my proposals can be vetted, because I feel like we have to level with people for the very reason, Gwen, that you are mentioning. There is a great deal of skepticism about the federal government. I'm aware of that. It comes from the right, from the left, from people on all sides of the political spectrum. So we have a special obligation to make clear what we stand for, which is why I think we should not make promises we can't keep, because that will further, I think, alienate Americans from understanding and believing we can together make some real changes in people's lives.
But I haven't heard either of you put a price tag on your... You say
I will put a price tag. My price tag is about $100 billion a year, and again, paid for. And what I have said is I will not throw us further into debt. I believe I can get the money that I need by taxing the wealthy, by closing loopholes, the things that we are way overdue for doing. And I think once I'm in the White House, we will have enough political capital to be able to do that. Well, but I am conscious of the fact that we have to also be very clear, especially with young people, about what kind of government is going to do what for them and what it will cost.
Senator.
Well, Secretary